Hi, I'm Dr. Tan Junji. I'm a senior lecturer in Advanced Medical and Dental Institute, University Science Malaysia. Welcome to ALPS Talk. The heart is an organ that continually pumps on an average 80 times per minute to propel 8,000 liters of blood to every part of our body each day. When I was in the secondary school, I learned the life-saving skill called CPR, the cardiopulmonary resuscitation. This technique can help those unconscious victims whose heart suddenly stops pumping to contract again with the help of automated external defibrillators. It emphasizes on chest compressions to produce external force to help the heart to pump and restore temporarily the blood circulation, keeping the brain and other vital organs alive and thus able to bring the patients back to life again. My interest in heart research was stemmed from this experience. Nonetheless, heart disease is still the primary cause of death in Malaysia. According to a report by the Department of Statistics Malaysia, ischemic heart disease claimed more than 18,000 lives of Malaysian people, which equals to 50 deaths each day in 2018. Over 12,000 of those were men, and majority of them were more than 40 years old. Ischemic heart disease is commonly a result of a blockage in blood vessels that serve the heart muscles, reduce and stop supply of the nutrient and oxygen, and that process can cause up to 1 billion heart cells to die and be replaced by a scar tissue. Because of the ischemic injury, the heart has a lesser contractile unit. Then the survivor ones will have to work harder to keep up the blood circulation to the needs of your body. This will actually cause the heart to slowly change the architecture by becoming large, and the muscle wall will get thinner and eventually fail to pump the blood effectively. We name this progression as heart remodeling. Statistics have also shown that about 50% of the patients with heart failure die in 5 years, and only 20% of them survive after 10 years. The only cure for these patients is heart transplantation. Again, this procedure subjects to the organ availability and immunocompatibility with the recipients. Studies have also shown that the heart has a very limited capacity to regrow itself. Fundamentally, all drugs and treatments we currently have in the clinic can only alleviate the symptoms following the heart attack or failure. None of those can restore the heart cells number and stop the remodeling. Hence, it is impossible to mend and regenerate the broken heart without stem cells. But again, not all stem cells can make heart cells. The most promising stem cell type that can make bona fide human heart cells is the pluripotent stem cells. The typical example of pluripotent stem cell is the embryonic stem cells. Embryonic stem cell is the only cell that can become more than 200 types of cells that you can find in the human body. However, the use of embryonic stem cell is always surrounded by ethical issues, whether sacrificing a human embryo means sacrificing a human life. The same problem with immunorejection will still be there. So what's the solution? A Japanese Nobel laureate, Dr. Shinya Yamanaka, introduced an innovative method called cellular reprogramming. This technique can return the differentiated cells like skin cells or blood cells back to behave like embryonic stem cells. These stem cells can be grown in the laboratory and they multiply themselves indefinitely. By giving them the required signal, they can also differentiate into all 216 types of cells that you can find in the adult humans. These cells are called the induced pluripotent stem cell. Though there are still some roadblocks that needs to be lifted, I believe these cells will soon be used as a therapy in the near future for heart disease. This is Dr. Junji. Thanks for watching, and I will see you again.